How do acute gout medications cause side effects? When you think about treating a gout attack, it's easy to focus on relief, but it's important to understand how these medications can sometimes cause side effects. Each drug works differently, and that can influence how your body reacts. Let's explore how these medications might lead to unwanted effects. Starting with colchicine, a common medication for gout attacks. It works by disrupting microtubules in white blood cells, which helps reduce inflammation. But because it also affects cells in the gastrointestinal tract, many people experience stomach upset, diarrhea, nausea, or vomiting. In some cases, colchicine can cause nerve issues, muscle damage, or blood problems like low white blood cell counts. These side effects happen because the drug influences cellular processes beyond just the inflamed joint, especially if taken in higher doses or if kidney function is impaired. Next are non-steroidal anti-inflammatory drugs, or NSAIDs, which block enzymes called cyclooxygenases. These enzymes produce prostaglandins that protect the stomach lining and support kidney function. When NSAIDs inhibit these enzymes, it can lead to stomach ulcers, indigestion, or bleeding. They can also raise blood pressure, cause fluid retention, and sometimes harm the kidneys, especially if used for a longer period or in people with existing kidney issues. Although NSAIDs are usually used short-term during a gout attack, these risks are still important to keep in mind. Corticosteroids like prednisone are powerful anti-inflammatories that suppress immune responses. When used for gout, they can cause side effects such as increased blood pressure, higher blood sugar levels, mood swings, and fluid retention. These effects are due to the way steroids influence metabolism and fluid balance throughout the body. Usually, short courses are better tolerated, but monitoring is still necessary to prevent complications. Allopurinol is often used for long-term management of gout, but it can be started during an attack as well. It reduces uric acid production by blocking an enzyme called xanthine oxidase. Side effects include skin rashes, nausea, diarrhea, and sometimes elevated liver enzymes. In rare cases, it can cause serious allergic reactions or kidney inflammation. Interestingly, starting allopurinol can sometimes trigger a gout flare because it mobilizes uric acid crystals, which is why doctors often recommend anti-inflammatory medications at the same time to prevent this. Drug interactions also play a role in side effects. For example, colchicine can interact with certain antibiotics like clarithromycin, increasing the risk of toxicity. Patients with kidney or liver problems may need dose adjustments to avoid accumulation and adverse effects. Factors like age and other medications can influence how likely you are to experience side effects. In summary, while these medications are effective at controlling gout symptoms, their mechanisms can also impact other parts of your body. Gastrointestinal issues are common, especially with colchicine and NSAIDs. Corticosteroids and urate-lowering drugs can affect your metabolism and immune system. That's why it's crucial to use these medications carefully, follow your doctor's guidance, and report any side effects promptly. Always remember, individual responses vary, so personalized medical advice is key to safe and effective treatment.